Have you ever pondered the significance of video laryngoscopy in intubation procedures? This simple question sparks a conversation that has the power to transform the way we approach one of the most critical procedures in healthcare. Intubation, a procedure where a tube is inserted into the windpipe to maintain an open airway or to administer certain drugs, is a routine yet crucial task in the medical field. Traditionally, this was done using a direct laryngoscope, which often required the operator to physically align the oral, pharyngeal, and laryngeal axes to visualize the vocal cords. This could be physically demanding and often led to a substantial rate of failed intubations, particularly in patients with difficult airways. Enter the video laryngoscope, a tool that has revolutionized the way we perform intubations. By providing a clear, magnified view of the patient's airway on a handheld screen, it mitigates the need for physical alignment of the airway axes. This feature alone dramatically reduces the physical strain on the operator, leading to a smoother, more comfortable experience for both the patient and the healthcare professional. But the advantages of video laryngoscopy don't stop there. By offering a visual representation of the airway, it allows the operator to anticipate any potential difficulties, improving the chances of a successful intubation on the first attempt. This is particularly beneficial in cases with difficult airways, where the traditional method often falls short. Moreover, the visual feedback provided by the video laryngoscope fosters a better understanding of the process, allowing for continuous learning and improvement. It also facilitates teaching, making it an invaluable tool for training new healthcare professionals. In essence, the video laryngoscope has taken a procedure that was once dependent on the operator's physical strength and transformed it into a process that emphasizes skill, precision, and knowledge. It has significantly increased the success rate of intubations, reduced complications, and enhanced the overall safety of the procedure. So you see, video laryngoscopy has revolutionized the world of intubation, making it safer and more efficient. Now, let's delve into the equipment, the video laryngoscope. This innovative tool is composed of three main parts: the handle, the blade, and the camera. The handle is similar to that of a traditional laryngoscope, designed to offer a good grip and control. It houses the power source, usually a battery that powers the device. The handle is ergonomically designed for comfort and efficiency, allowing for precise manipulation. Moving on, we have the blade. The blade of a video laryngoscope is a critical component as it is responsible for displacing the tongue and soft tissues, providing a clear view of the larynx. There are different types of blades available, each with their own unique characteristics. Macintosh blades, for instance, are curved and designed to lift the epiglottis indirectly. They're often used for routine intubations and are available in different sizes to accommodate patients of varying ages and sizes. Miller blades, on the other hand, are straight and designed to lift the epiglottis directly. These are commonly used for pediatric intubations or in cases where the anatomy is difficult to visualize. Finally, we come to the star of the show, the camera. Situated at the tip of the blade, the camera provides a high-resolution image of the patient's airway, displayed on a connected monitor. This allows for a significantly enhanced visualization of the larynx, making intubation a much smoother process. Choosing the right blade is crucial and depends on various factors, including the patient's anatomy, the clinician's experience, and the specific clinical scenario. It's always a good idea to have different types of blades available, ensuring you're prepared for any situation that comes your way. The video laryngoscope, with its innovative design and functionality, is a game-changer in airway management. It not only enhances the view of the larynx but also improves the success rate of intubations, particularly in challenging cases. So, now that we have a better understanding of the video laryngoscope, let's move on to how to use it effectively. Now that we understand the equipment, it's time to discuss the step-by-step process of intubating with a video laryngoscope. The first step in this process is patient preparation. It's vital to ensure the patient is adequately sedated and paralyzed, as this will make the procedure smoother and more comfortable for the patient. It's also important to pre-oxygenate the patient to maximize oxygen reserves and minimize the risk of desaturation during the procedure. Once the patient is prepared, the next step is proper positioning. The ideal position is the sniffing position, where the head is elevated and the neck is slightly flexed. This position optimizes the alignment of the oral, pharyngeal, and laryngeal axes, making it easier to visualize the vocal cords. The third step is blade insertion. Here, the video laryngoscope comes into play. The blade of the laryngoscope is inserted into the patient's mouth and advanced along the center of the tongue. It's crucial to avoid using the teeth as a fulcrum to prevent dental trauma. The blade should be advanced until the glottic opening is visualized on the video screen. Next is the visualization of the airway. The video laryngoscope provides a clear, magnified view of the vocal cords and surrounding structures. This visual aid is invaluable, particularly in difficult intubation scenarios. The laryngoscope should be manipulated until the best possible view of the vocal cords is achieved. The fifth step is tube insertion. A preloaded endotracheal tube is gently advanced through the vocal cords under direct vision. It's important to advance the tube smoothly and without force to minimize the risk of airway trauma. The final step is confirming correct tube placement. This is done by visualizing the tube passing through the vocal cords and by auscultating bilateral breath sounds. An end-tidal CO2 detector can also be used for confirmation. As with any procedure, there are potential challenges and complications associated with intubation using a video laryngoscope. These can include difficulty in visualizing the vocal cords, inability to pass the tube through the cords, and potential risk of aspiration. However, with experience, these challenges can be overcome, and the benefits of video laryngoscopy, such as improved visualization and increased success rates, can be realized. In conclusion, the process of intubating with a video laryngoscope involves several key steps: patient preparation and positioning, blade insertion, visualization of the airway, tube insertion, and confirmation of correct placement. Each step is vital and requires careful attention to detail and technique. Intubating with a video laryngoscope may seem complex initially, but with practice and understanding, it becomes a straightforward process. As we wrap up, it's crucial to remember the key points about intubating with a video laryngoscope. First and foremost, the importance of the video laryngoscope cannot be overstated. This tool is a game changer in the world of intubation, offering healthcare professionals a clear, magnified view of the patient's airway. This visual aid can significantly improve the accuracy of tube placement, reducing the risk of complications and improving patient outcomes. Next, it's essential to have a solid understanding of the equipment. The video laryngoscope is a complex tool, and it's vital to know its parts and their functions. The blade, the camera, the light source, and the screen all play a crucial role in making this device an indispensable part of the intubation process. Remember, skillful handling of the equipment can only come from thorough knowledge and practice. Let's not forget about the process of intubation itself. Using a video laryngoscope, the steps include positioning the patient, inserting the blade, visualizing the vocal cords, and finally, guiding the tube into the trachea. Each step requires precision and careful attention to detail. Remember that while the video laryngoscope provides a visual aid, it doesn't replace the need for careful technique and clinical judgment. Finally, we must appreciate the advantages offered by the video laryngoscope. It not only improves visibility, but can also reduce the need for force during intubation, which can be particularly beneficial in patients with difficult airways. Additionally, the video element can serve as an excellent teaching tool for trainees, providing a real-time view of the procedure that can't be matched by traditional methods. In conclusion, the video laryngoscope represents a significant advancement in intubation technology. Its benefits extend beyond improved visualization, offering advantages in patient safety, procedure efficiency, and medical education. So whether you're an experienced healthcare professional or a student in training, mastering this tool can significantly enhance your intubation skills. Remember, the goal of utilizing a video laryngoscope is to ensure patient safety and enhance the efficiency of the intubation process. In conclusion, video laryngoscopy is a significant advancement in the field of intubation. It's not just a tool, but a game changer that has the potential to revolutionize patient care. It's a valuable instrument that combines the traditional approach with the modern, offering a clear view of the airway, increasing the chances of successful intubation while minimizing complications. This is why it's so important to understand and use this device effectively. It takes more than just knowledge, it requires practice. Like any skill, proficiency comes with time, with trial and error. So don't get discouraged if you don't get it right the first time. Keep learning, keep practicing. Remember, in the world of healthcare, every second counts and every skill matters. The proficiency you gain today could be the difference between life and death tomorrow. With the right knowledge and practice, the video laryngoscope can truly be a lifesaver in airway management.